This is a video made by Interim Healthcare, the Gift of Hospice, serving San Diego County. The purpose of this video is to provide an introduction to what hospice is and does, some education on a few of the common misunderstandings about hospice, and an awareness of our presence in the community. Interim's mission is to give patient and family-empowered care, preserving dignity and providing comfort. We value each patient as an individual and are dedicated to providing customized care that meets the needs of each person in the comfort of their home during end of life. So what is hospice and who uses hospice services? Hospice is an end-of-life healthcare service that is based on compassion. There are many different types of patients using hospice for many different reasons, but all meet certain criteria in order for hospice services to be found appropriate for them. People using hospice have a diagnosis of a terminal illness or a prognosis of 6 months or less to live if the disease were to run its natural course. Contrary to a common misconception, this does not mean that all people who are on hospice care will die within 6 months. People can be on hospice for longer, sometimes even years, as long as they meet recertification criteria that is specific to their disease process. They can also discontinue hospice services at any time for any reason. Many people wait a long time, often too long, before receiving hospice care. This comes from a misconception that they need to wait until they or their family member are in great need of the care so that they don't use up the benefit too soon. Hospice is not a one-time limited service. If the situation warrants, patients can go off of hospice and then decide to use it again throughout their life an indefinite number of times. The foundation of the hospice philosophy is built on palliative or comfort measures as opposed to curative or aggressive treatment. All patients that sign on with hospice agree that this mode of care is the most appropriate for them at this time in their lives. Hospice is designed to help the patient live as fully as they can with quality of life until they pass away. So when asked who is involved in hospice care, this question really depends on the organization. Our hospice team consists of trained and licensed healthcare professionals that are nationally certified in hospice and palliative care. At Interim Hospice, we have a physician, nurse case managers, social workers, therapists, certified hospice aides, chaplains, a bereavement counselor, a massage therapist, and volunteers that are all trained specifically for end-of-life care. We have an excellent physician here at Interim Hospice that is involved in all patients' care who can be elected to be the patient's primary care physician. However, patients are at liberty to keep their own primary care provider. Many people who have a long-standing relationship with their primary care provider do not want to give that up. That is not a choice people have to make when going on to hospice care. Patients are entitled to keep their primary care provider, who will still guide their care, but will work in partnership with our medical director. Most patients will be visited multiple times each week by our hospice team. During these visits, patients are assessed, medications are adjusted, and support is given. All visits are at the patient's residence, so they never need to leave the comfort of their home. Staff work around the clock, 24/7, so patients and families can be assured that there is always someone they can contact to answer a question or to be present in a time of need. What does hospice do? Put simply, hospice works to be there for the patient and the family whenever needed, and then some. We go wherever the patient is, which includes skilled nursing facilities, homes, and residential care facilities for the elderly. We also work with people that are homeless. Our social workers work to provide living placements for them. So essentially, we will take care of someone wherever they are, no matter where they are. Interim Hospice is well integrated into each community in San Diego County. Members of the team go to the patient's home for regularly scheduled visits based on the patient's needs. This means we have an established relationship with the patient and the family. It is very important for members of the community to recognize and be aware that nurses and other people on the hospice team are going into homes providing care frequently, which is their job and responsibility. This could be any home or facility next door to you. It is imperative that hospice is allowed into the home whenever the need arises. Hospice is present before, sometimes during, and after the patient's death. We provide medical care, access to other resources in the community, and counseling for the patient and family. Hospice is the first medical group called after the patient's death for post-mortem care, which involves cleaning the body and preparing it to be sent to the mortuary. Mortuary and funeral arrangements will have already been arranged before the patient's death. We are not only there for physical, psychological, social, and spiritual support before the patient's death, but we also remain present for the patient's family after their passing. So what does it mean to be on hospice? Because hospice is end-of-life care, the purpose again is for comfort, not for cure. Patients who are on hospice are being treated for symptom management and pain control. In a time of crisis, patients call hospice, not 911. In fact, hospice becomes the patient's 911. This is agreed upon while signing up for hospice. There will always be someone working to answer calls from patients and their families, so 911 and/or the police do not need to get involved. Nearly all hospice patients are on medications that help keep them comfortable and well palliated, so it can be expected that drugs are involved in patient care. Some of the common medications used in end-of-life care include narcotic pain relievers, such as Norco, Vicodin, morphine, oxycodone, and fentanyl. Other common drugs used for hospice patients are benzodiazepines, like Ativan, also known as lorazepam, and Valium, also known as diazepam. All of these are prescribed, regularly monitored, and frequently adjusted. Contrary to another common misconception, not every hospice patient will use morphine, nor does morphine cause their death. The family and patient are empowered to choose their own palliative treatment, which includes the medications they prefer to use or not use. Some patients will be on a continuous pump of medications, some will have a medicated patch, some will take pills, while others who have trouble chewing and swallowing will have their meds given to them by oral syringe. This is an oral syringe, and it just simply does not have a needle inside of it. Others will have medications injected by needle. Nevertheless, all of these routes are approved by the hospice medical team. Medications are kept in various places, such as pill boxes, the fridge, and syringes. It's very important that these meds are not moved without the patient, family, or staff being made aware, because they're accustomed to getting their medications in one particular spot with easy access. While there will not always necessarily be a list of meds in the house, there will always be a pharmaceutical label on the front of all of these medications. Furthermore, standard procedure for all patients when signing on to hospice care is to be given a comfort kit that has a handful of medications that we offer to all patients if ever needed. This can be expected to be in the house of every hospice patient, and it includes meds for restlessness, agitation, anxiety, pain, and shortness of breath. It'll come in a plastic baggie like this and will almost always be kept in the refrigerator. So how do you know a patient is receiving hospice care? Depending on the patient's disease progression, you may not know that they are on hospice. However, inside the home of every hospice patient is a folder outlining their plan of care and how hospice is there to serve them. This folder says interim hospice on the top and has our number so that we can always be reached in a time of need. It is kept in one central spot that the patient and family have chosen, and the folder may not be in plain view, but there will be other signs of hospice care in the home. Some patients will have put the do not call 911 sheet on their fridge or over the bed, and it's a red sheet that looks just like this. Sometimes there will also be an interim calendar or a magnet that says interim hospice on it, and these more likely than not will be in clear sight. Many patients, but not all, will have a POLST. This stands for Physician Orders for Life-Sustaining Treatment, or they might have another form of advance directive. These outline what measures the patient would like a medical team to take, such as resuscitation, intubation, or feeding tubes. Most patients, though not all, are DNR, or do not resuscitate, which we will have labeled here. It is very important that their wishes be followed. The purpose of all of these papers being present in the home is to help the patient have a say in living out the rest of their life in a way that they can control, direct, and enjoy. End of life is a markedly challenging, sensitive, and vulnerable time for patients and their families. Hospice patients sometimes feel afraid, abandoned, or discarded. Interim hospice treats patients with respect and gives them a sense of empowerment, autonomy, and dignity in their care. We are there to alleviate some of the stress patients feel when they're facing end of life, and some of the stress families feel when losing a loved one. We value being part of the healing process, which begins upon first visit with the person and continues after their death with their loved ones.